Is Tami Rich, and my name on Twitter, my handle is Boston Heart Mom, and I am the mom of Jameson, who is 25 years old and was diagnosed at birth with congenital heart disease, complex congenital heart disease. My background was in hospital finance and quality improvement and strategic planning until there came a point when my son was about 8 or 9 years old, when he developed a really complicated lung disorder that came from the heart reconstructions. So I think it was Aristotle that said, today's solutions sometimes cause tomorrow's problems. And that's what happens sometimes with the body. And so I quit work to become his full-time case manager at that time. And he now lives in New York. He's, as I say, he's 25. And I briefly worked for a while in a patient safety coalition, and I worked at Mass Senior Care for a while doing quality improvement and some training. But since then, I've mostly been focusing on advocacy and writing, and just trying to figure out kind of what my next role is going to be. So Jameson had 3 open heart surgeries before he was 3 years old. And we got lulled into thinking that maybe that was going to be it, and maybe he was going to be okay. Because what they were doing then was rerouting the heart a certain way to enable a child to grow. And it was anticipated that that would be all he would need. It was difficult to go through that, but the best part about it was he was so young, especially 2 of his surgeries were when he was an infant. You have the fact that memories are usually not retained from a baby so young, number 1, and number 2, at Boston Children's, where he had those surgeries done, they would use medication to give him amnesia. They would use Versed every time they did any kind of a painful procedure. So I'm very lucky in that a lot of the thinking about whether or not children felt pain was very antiquated and incorrect for decades. But in the 90s, we were blessed with the fact that they never wanted him to experience pain. Of course, he did have to, so it was really challenging back then to try to balance what he needed for care versus wanting to protect him from any problems.